Welcome back to another Chatting with Chat. Today, we're talking about the parts of healthcare that do not always show up in a chart or policy, but deeply shape how people experience care. I'm really excited to be joined by Dr. Olga Kagan. Olga is a registered nurse, educator, healthcare innovator, and all around just rock star with 30 years of experience across care delivery, academia, and nursing informatics. Her work focuses on patient safety, food allergy care, and how technology can improve care without losing sight of the people it is meant to serve. She is the founder and president of the Food Allergy Nursing Association and has held leadership roles with organizations including the Healthcare Information and Management Systems Society, the American Nurses Association, and the New York Academy of Medicine. Across these spaces, Olga has helped bring a nursing perspective into conversations about research, technology, and patient experience. She is also professor and mentor to future healthcare leaders, giving her a thoughtful view of where healthcare has been and where it still needs to go. Dr. Kagan, thank you so much for being here. I'm really excited to dive deeper with you today.
Well, thanks for inviting me. I deeply appreciate it.
Yeah, no, of course. So I guess why don't we dive right in? Your career has taken you across places where care is delivered, studied, taught, and redesigned. There's really literally nothing that you haven't been involved in. When you move across that many spaces, what kind of problems start to look connected?
Wow, that's a great question. And as you said, yeah, moving across all those different spaces, clinical care, academia, public health, innovation, you start to see some issues that kind of like repeat themselves, like you almost see a pattern.
Hmm.
And no matter the settings, patients and nurses are often navigating systems that weren't really designed with them in mind. And whether I'm teaching students or mentoring during hackathons or working on allergy education, I see those patterns over and over. And those typically are fragmented workflows,
Yep.
communication gaps for sure. And when now being involved with technology as an
Hmm.
informatics nurse, I see a lot of um, things emerge around technology burden, actually. So even though we want technology to alleviate burden, all of a sudden we're starting to see additional burden put on patients and nurses. And lastly, I would say lack of structures that support nurses as innovators, and that is something that we try to remediate through our work at SANCIEL, which is the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. And so once you live across all those spaces, you kind of realize that these are not separate problems, and they're more like connected symptoms of the system, if you
Hmm.
will, um, that haven't really fully embraced human-centered design. Because when we're talking about all these different interest groups,
Yep.
we want to make sure we design with them in mind. So if we're delivering to the patient has to be part of that build. If they're nurses, nurses have to be part of that build and design. And that only changes when nurses and patients are part of those solution processes.
Right. No, and I love how you started that by talking about thinking about designing with nurses and patients in mind and how that hasn't been done historically. Obviously, it's something that we at Care+Wear are really focused on. And when you think about something even as standard as a patient gown, it's an opportunity to touch dignity, access, and mobility. And it's just such a reminder that small design decisions can shape the entire care experience.
Yeah,
Um,
absolutely.
so you were part of the World Trade Center worker and volunteer medical screening and monitoring program at Mount Sinai from the beginning. What did that experience teach you about caring for people with complex long-term needs?
That experience, I think, was one of the most profound experiences for me as a nurse and
Yeah.
also as a citizen of the United States of America, because I, was born in a different country
Hmm.
and I escaped all types of injustices and prejudice. And so moving to the United States and witnessing the attack on on my city here in New York was very, very personal to me. I think there was not only physical, but like emotional um, a reaction. And
Yeah.
so when I saw that there was a program established through the grant at the time to help monitor those who worked at Ground Zero, I jumped on the opportunity because I wanted to be able to serve that population. And we were caring for people whose lives had been completely disrupted, physically, emotionally, socially. And those conditions did not fit neatly into your traditional clinical pathways.
Yeah.
So what it taught me is that long term, the complex care requires consistency, listening, and also systems thinking, which I learned actually later on as well as a nurse phoneticist. So the patient needed a team that stayed with them. And we initially got a grant for only a year, and we knew that data was so important in order for us to secure additional funding. So part of the program was research, of course, so we can have long-term and short-term and long-term longitudinal data
Hmm.
on the health conditions that resulted from those exposures at ground zero. Um, and, we saw that the symptoms didn't always match the textbook because they were exposed to a very pulverized mixture of things that we haven't seen before, like
Right.
asbestos and glass and plastic. I mean, it was just a whole bunch of things that they were breathing in while working there. And these included detectives and asbestos handlers and sanitation workers and social workers. I mean, even just regular volunteers who either lived or worked or who moved to New York to help, at that site, to help
Right.
clean up that site. So you can't really treat a chronic exposure related illness without addressing all of the issues related to it, like the mental health, the stress on the family, occupational challenges because they were using different equipment, heavy equipment, etc., and access barriers. So
Yeah.
if we found something related to that condition, we then didn't have a recourse of sending them for treatment, especially if they didn't have health insurance or
Right.
if they became disabled or unemployed. So depending whether they worked for a union or non-union organization. So it was a whole other host of things, and I'm happy to see this program running today. And it's now has a treatment component to address some of those access to treatment barriers. So I'd say it's for me what this program really taught I think me is that relationship building.
Yeah.
So our care, because our care is so episodic, we're so focused on like very fragmented episodic care that we forget about the relationships that we have to build with these people in order to see them long term and make sure that they improve.
I love
Anyway,
that.
yeah, I'm sorry, I feel
No,
very passionate about the topic, so
no,
I
I
can
think
I
it's,
can
I
talk
mean,
nonstop.
it's exactly, I feel the same way. And I mean, my friends and I talk about this still. We still remember where we were on September 11th, and just hearing the impact and knowing that people like you were there to help so many people, not just New Yorkers, but around the world that were impacted, I think is so incredible. Um, but as much as I hate to move on, I think we should. How do you think about using data and technology without you losing the human experience behind them?
So for me, technology is really a tool, not necessarily the goal, right?
Yeah.
And AI is being part of that equation right now.
Hmm.
So ever since even going back to the 9/11 program, data was very important because data drives research, evidence-based practice, data drives funding, data drives a lot of different factors. And
Yeah.
so um, I believe that data really should help us understand people better and not necessarily distance us from that human component.
Hmm.
And so I always ask, when it comes to technology, I always ask, does this help reduce cognitive load? Does this help us see patterns that we couldn't see before, which will help us hopefully deliver better care or remove redundancies or automate things?
Hmm.
does it give patients more agency or clarity, right? Especially now with AI being part of care, like
Yep.
even when you look at patients' bill of rights, now we may have to revise that because AI was never part of that, and
Right.
now it
Right.
is. So, like all these little things that come along with integration of technology to help us with driving data and hopefully use that data to, give us some more information and then um, help us deliver better care. As long as those tools can help free clinicians to do the work
Yeah.
that only we people can do, I think that's great. But once it becomes hindrance, that's when I think we got to be able to draw the line. So it's always kind of living on that edge, trying to figure out the balance.
Well, I think speaking of living on the edge and technology, obviously it's something you've not only done in preaching and practice, but you've also written a book. I was very fortunate to get a signed copy a few weeks ago at AONL. Um, Talk to me, I guess, a little more about the book and share with our listeners about what got you down that journey as well.
So this is actually interesting because a colleague of mine who has written a book before, Dr. Mary Jo Garcia Dia, had called me and she said, Olga, let's write a book because I think there's a need. And indeed, she was right because at that time in 2021, nurses started implementing new guidelines for competency-based education, and
Hmm.
informatics competencies is now part of the undergraduate and graduate curriculum for our nurses, because we know that nurses entering healthcare have to be prepared to function in a high-tech environment.
Yep.
And so we wanted to make sure that there is a resource for those nurses, whether they are aspiring nurse informaticists or they're just nurses who are looking to get more information on what informatics is all about. So that book kind of gives you that overview in a more engaging way. So it's not a typical textbook.
Hmm.
So we've got about 10 contributors to the book based on their individual expertise, anything from
Yep.
AI to patient-centered care to virtual nursing, robotics, innovation, ethical component, um, social determinants of health. I mean, it's pretty well rounded, and we wanted to make sure that nurses had a timely and updated resource at their fingertips as they
Right.
try to navigate today's high tech environment.
I love that. Um, All right, so talking about nursing and helping them with a guide and all that, let's think about it from the other perspective. So, you have founded the Food Allergy Nursing Association after seeing a need in the field. Where do you think healthcare innovation gets it wrong when nurses aren't in the room? Or maybe the politically correct way to say that is where does it what does it miss when nurses aren't in the room?
So, nurses are the largest workforce in healthcare, and we're
Yep.
talking nationally and internationally.
Hmm.
And I think we do a disservice to our patients if we're not including nurses when it comes to clinical decisions, when
Yep.
it comes to any decision that touches a patient. And so, in terms of food allergies, if we really look into that ecosystem, we know that we eat what 3 times a day at the minimum, and
Right.
food is part of our social fabric in every culture. But for millions of people, it has become what I would call it a health hazard, because they don't know if the next bite is going to kill them or put them
Yep.
in a position would require a medical attention. We have about 220 million people globally and 33 million Americans that live with food allergies.
Yep.
And the fear related associated with every bite is real. And we know that every 2 to 3 minutes, someone in the United States ends up in the emergency room because of food-induced anaphylaxis.
Yep.
And even though we're the largest profession, we don't actually have formal training in food allergy. We're not well informed in
Hmm.
how to care for people with food allergies. like we learn how to manage heart failure, diabetes,
Yep.
asthma, but we don't know how to identify hidden allergens. We don't know how
Yep.
to prevent cross contact, how to use different forms of epinephrine devices because there's more than one in the market
Right.
right now. And so nurses are really in a position to help improve some of the statistics that we're seeing. Like, right now, 1 in 12 or 13 children has food allergy. Over 50% of adults develop their food allergy after age of 18. And I think hospitalizations are over 260% higher than they used to be. And insurance data from a few years ago also showed us that insurance claims for anaphylaxis increased over 377%. So it's a huge, a burden on families financially too. They're about 24.8 billion dollar industry, of the burden that we're seeing on those families,
Yeah.
and very little research money. So it's less than 80 million is allocated on funding any kind of research in that space.
It's insane.
So it's truly problematic, and that's why I said something has to be done. And
Yeah.
given that we're the largest profession, how can we help address this growing public health concern? um, you know, we want to make sure there's access to care, specialty care, that families, that we, prevent any near misses situations, especially in schools,
Hmm.
because a lot of those reactions happen in school settings and sometimes for the first time.
Yep.
Any sort of confusion people have about different epinephrine devices, the emotional toll of managing this chronic and quite unpredictable condition, because sometimes, we say, previous reactions don't always predict future reactions. They could
Right.
be worse or they could be better.
Yep.
So that's the unpredictable nature of this condition. And that's why we a group of us decided to start a Food Allergy Nursing Association so we can support alternative models of care to improve access to care. And we were publishing around the role of allergy nurse educator using telenursing, which technology can help now with.
Yep.
We talked about nurse-led innovation. We talk about translating evidence into practice, so we're not waiting 17 years to implement data into practice.
Right.
And so that's another component, nurse-led research as well, and education. A big thing is education, truly making sure that all nurses, or as many as we can reach, are allergy informed and they can serve our patients to ensure their safety, equitable care, and that it's human-centered.
Yeah. No, I love that. And I think, like you said, nurses, are the largest percentage in healthcare, but also they're your first point of contact. And so if you can help educate them, but also leverage their expertise, it's kind of a win-win. I know at Care+Wear, my mom is an anesthesiologist, and growing up, she always told me the most important person in the room is the nurse. They're the ones that really get to know the patient. They're the ones that really understand everything. And so for us, we include them in the design and development of each of our products because people like you are the reason that we even know what there is to solve for. And so I think it's really incredible what you're building. So you've been in healthcare now for
Almost
30 years. What questions do you find yourself asking more now than you did earlier in your career? And what questions do you hope future healthcare leaders will be brave enough to ask after?
Well, I'll be honest, I've always asked who's missing from the conversation. And that
Love
goes
that.
back to that nurses typically the ones oftentimes missing from the
Yeah.
conversation. And patients too, frankly,
Hmm.
depending or and everything we do in healthcare is patient-centered, at
Yeah.
least from the nurse's lens. And this is one of the questions I always ask: who's
Yeah.
missing? And the future leaders, I hope that they are brave enough to ask, what would this look like if we designed it around the people who actually use it?
Love that.
So that's, I think, in my opinion, these are the questions that
Yeah.
need to be asked.
No, no, I mean, I very much agree with you when you think about Like even when we designed our scrubs, it was getting the nurses, PTs, OTs, anyone that was wearing a scrub or touching a scrub, we wanted in the room and asking them, what do you care about? What do you not care about? How do we create something that can help you all? And I think it's that input that helps shape our products, that will help shape the future of the world and improve care to be as amazing as we can get. And obviously, we've gone a long way, but a long way to go. All right, so now we have some quick fire questions. What is a song that instantly puts you in a good mood?
We're the world. That's it.
We Are the World was
We're
such an
the
incredible
people.
song
Yeah.
by Michael Jackson. What's one thing your students or mentees have taught you?
My students and mentees, they taught me that it's never too late to learn, and I'm always learning from them.
I love that. Um, I went to UVA and Thomas Jefferson always said the same thing. And that's why at UVA there's no freshman, sophomore, junior, senior. It's first, second, third, and fourth year because we're always learning.
Mhm.
What's one thing people would be surprised to learn about you?
That I actually was a folk dancer.
That is that I'm not now having met you, that's not surprising, but for people that haven't had the opportunity to meet you, that would be very surprising. What's a hobby that you wish you had more time for?
I make artwork from hay.
Oh, wow.
And unfortunately, I wasn't able to find the quality of hay that I need in the United States. So
Yeah,
that hobby I would love to go back to as long as I can find the
find
quality
that
of
hay.
hay.
All right, so if we
Yes.
have any listeners that or watchers that know anything about hay in America, please get in touch with Olga. Um, Olga, this has been really incredible. It's such an honor for me to get to continue the dialogue with you. I think it's innovators like you that have helped transform healthcare today and in the future. And I know for me, it was such a delight to get to go to dinner with you a few weeks ago. I was trying to grab, I literally have your book right next to my desk, but it's right out of grabbing distance. But it was also an honor to get a version of your book signed by you. Huge thank you for spending the time with us, for taking care, and for helping innovate the world and make, as Michael Jackson would say, make the world a better place. So thank you very much.
Yes. Thank you so much.